Hi, this is Dr. Antelak from theGentlDentist.com in Shelby Township, Michigan. In case you're interested in about implants, in that, our phone number is 586-247-3500. Today we have Kristen, and she's agreed that we can record this and put it on YouTube. And what I wanted to do is to mention this is about dental implants that we're using to replace a root canal that she had, and then she had surgery on it and it never worked out. And so if we look over here, this is where she currently is. Or we took this tooth out about 3 weeks ago, and she went to a specialist, and they tried to fix it, and it was not able to be repaired. And so we extracted that around 3 weeks ago. And tell us what it was like then and what it's feeling like now at this point.
It's a sense of relief after the tooth was pulled out. I had felt like a heaviness in that area, and I could feel my finger running over that spot right above in the gums. I ended up with an abscess, so that's when I came in. Otherwise, I wouldn't have known anything had gone wrong with the apicoectomy before. But it's like a weight off my shoulders now that the tooth is gone, because it's been years of issues with it.
Yeah, so it's been a long period of time where this has been a chronic infection, so by taking it out, giving it a chance to heal initially. But if we wait too long, how it is with implants, if we wait too long, then actually the volume of bone, the width of the bone starts shrinking down to, even at 6 months, you get like 50% shrinkage of that bone. So we're going to be doing it now today. Let me show it to you. So we're going to go ahead and first off, what I want to do is to show you that I usually don't leave my patients without anything in their mouth. And so bring your head towards me a little bit here. So this is where we took. So what I want to do is to make sure that whenever we extract a tooth, that I don't leave our patients, especially in the smile zone, someone who's obviously conscientious about her appearance. So we try to make it so that you don't go without your tooth. So even after I extracted that one tooth, which ends up being this tooth here, this is one area that we're working on today. So we're just doing that. We're not even going to create what's called a flap on it. We're just going to do this without that. Okay, now we're going to take an X-ray. The that we have is 13 millimeters long, and it actually goes from here, about this long here. So do you want to see it? Mm-hmm. The implant's about this long. That's what's going to go in your mouth. Okay?
All right.
Isn't that exciting? All right, so I have to be really careful. These are sterile gloves, and when we do that, we just use this is called the driver. And this is actually going to be the abutment. The part on the end of it is this, where it's this part right here is that part that's going to stick out. So let's see. Now, as we place this in her mouth, Kristen, you're just going to feel some pressure, okay? And so what we'll do is we'll end up we saved a little bit of her bone that we ended up taking there, and then we're just going to pack some of that around the threads of this when we're done. What we also do is we torque it into place. So we have this little device called the torque wrench, and believe it or not, it tells us how much pressure that we're placing on the implant. What it will do is it'll give us an idea of how strong that's actually in her jaw. The implant itself, which is in the jawbone, now this is the abutment part. I'm just going to unscrew this part here, and we'll take a look and see what's going on here. So I'm going to just take this off. Now the implant is actually sitting inside of her jaw here. The implant's sitting right in here. The base of it's right there. Okay, so it's in her bone, and then we'll screw that other part on and make the crown on. Place the implant now. We also put what's called the abutment part that's on it. And so currently this is what she has right now if we look at this. So right now this is a titanium, and this is actually screwed onto the implant that we showed you just previously. And we're going to make a temporary crown to go over the top of this, and we're actually going to bind it to this adjacent tooth here so it doesn't put a whole lot of torque and pressure on this. This has to mature, and the bone has to grow inside those threads that were placed inside there. And so that's what we're going to have for success.